The fight against malaria is not just a collective or corporate fight. It involves individuals fighting the war. Malaria disease has been overwhelming, especially in the African continent. Even in Nigeria, which has the greatest population affected by malaria. In this video, I will be talking to you about how you as an individual can fight and win the war against malaria. Stay tuned. On today's topic, we are looking at your fight as an individual against malaria. It is not just a physical fight. It is a fight that involves being proactive, that involves being disciplined, and this will go a long way in helping you and helping us as communities to fight the war and win the war against malaria. Zero malaria begins with you. So let's look at what weapons that you can use. Yes, weapons that you can use as an individual, even as a family, to fight and win the war against malaria. So the number one weapon I want to talk to you about is insect repellents, mosquito repellents. These repellents are available in pharmacies, in stores. What these repellents do is to push away mosquitoes so that they don't come near you. Repellents contain some chemicals that repel, that push away mosquitoes and make them go away from you. So you can avoid mosquito bites by use of this mosquito repellents. But for you to use this, you should consult with your doctor to be sure that these repellents will not cause harm to you, especially if you're a pregnant woman, especially for children, and your doctor should confirm that this will be a weapon that you can use as an individual. Okay, use mosquito repellent in your fight against malaria. They can also be applied to some clothing, just like some creams may attract mosquitoes. These repellents help to repel mosquitoes and prevent you from having mosquito bites, which may lead to malaria disease. Another important weapon approach that you can use is wearing long sleeves. Yes, long sleeves help to protect us in those areas that would otherwise have been unprotected and exposed to mosquito bites. So when you wear protective clothing, like long sleeves, like turtlenecks, like trousers, wearing of your socks, this will help prevent mosquito bites and prevent malaria disease, especially during the dawn and the dusk when mosquitoes tend to thrive and move around. Okay, I'm sure you have noticed that most of the time, even apart from in Nigeria where you have mosquitoes sometimes everywhere during the day and night, but commonly mosquitoes tend to thrive in dark places, dark areas during dark times. So early in the morning and late at night, evenings are periods where mosquitoes may be around, and so at such times it is very important to protect yourself, and especially for pregnant women and children, you should ensure that they are well covered even when they are asleep at night, so that you can prevent mosquito bites and eventual malaria disease. Next is use of insecticide treated nets. These nets can be used as bed nets. They can be used even in camps and different places. As an individual, you need to note that insecticide treated nets are very useful. They are even distributed freely in some cities, in some local governments, in some communities. You can even buy one for yourself and for your family. So what these insecticide treated nets do as weapons against malaria is to prevent the mosquitoes from getting to you. In fact, it's a barrier method of preventing the disease. They are actually impregnated with chemicals that also repel mosquitoes from coming around you. So use insecticide treated nets, especially if you're a pregnant woman and for children. Every adult can use this, but sometimes people complain about the heat and the discomfort that this may generate, and some people may even be allergic to it. So it's important to treat appropriately as directed. There are instructions that come with insecticide treated nets in terms of preparing it before use and how to maintain it. But if you have some allergies, if you have reacted to such chemicals or nets before, then you may need to consider other weapons, other options in dealing with malaria. Next is use of indoor residual sprays. Indoor residual sprays contain chemicals that help to kill mosquitoes, and when we spray this at any time on the walls, on the window nets, in the door nets, in corners, in toilets where mosquitoes tend to thrive, then we will be killing mosquitoes that may be causing malaria in our environment. So as an individual, whether you are living in a single room or in a family house, you have to, at different times in the month, in a week, spray insecticide. Follow the instructions in using this so as to prevent exposing yourself to this chemicals. So what you should do is to spray, and then while you're spraying, you need to use your face mask, nose mask, so that you can be protected and everyone stay out. The windows are closed, the doors are closed, and you stay out for some minutes for the effect to take place on the insects and mosquitoes. Even cockroaches will benefit from that fight, and then they will actually be killed in that process, and other insects, so that you can then come in, open the windows, open the doors, and then have some aeration with the door nets closed, with the window nets well locked, but the windows open for aeration and other sources of air and ventilation into the room. So you will enjoy this. If you have been doing this, and if it has been a while since you did this, I want you to go back to it, as this is part of the weapons that you can use, and a very veritable one that you can use in the fight against malaria. Next, there are also some mosquito repellents in terms of coils, some substances, vaporizers that can be used. Some of these can actually be used while you are even indoor. So, but you need to confirm whichever one you are buying to be sure that it can be used in that way. So, what you should do is to get mosquito vaporizers, insect vaporizers, insect repellents that can be used in your room, in the sitting room, in the toilet, in different places where mosquitoes tend to thrive. So use mosquito coils and repellents also. Next is the use of mosquito lamps. Talking about technology. Technology is one of the ways by which we have learned to fight the war against malaria, and we are winning. There are many technologies available, one of which is the mosquito lamp. This will help in attracting mosquitoes in the environment, trapping them and killing them. That's one of the weapons that you can use in your fight against malaria. Two more weapons before I end this video. One is the use of anti-malaria drugs, oral medications or injections. Once you have symptoms suggestive of malaria, you need to present to your doctor, get tested appropriately, and if you have been diagnosed with malaria, you need to take your anti-malaria, whether orals or injections, as directed or as prescribed by your doctor, because this will help to fight not just the malaria or the malaria infection, it will also help to fight against drug resistance, so that we will all be winning the war against malaria. So take your anti-malarials as prescribed and And then the way to take it, let me tell you this, especially the one that you take for 3 days, which has the artemether content and lumefantrine, you are supposed to take this first at a 0 hour when you are first taking it. For an adult, for example, it's 80 milligrams. You take, if it's that dose, you take 1 tablet for a start, and then 8 hours after you take the next tablet, and subsequently 12 hours interval. So morning, night for the remaining 2 days, so that you would have completed the 6 doses. When you take this during this period, you also avoid taking vitamin C. Vitamin C has been confirmed to limit the effect of anti-malaria. So avoid taking vitamin C while you are doing this. I'm sure some of us are aware of this. So what about the injections? As prescribed by your doctor, follow the instructions and take your injections. Okay, I know some people love injections, they prefer injections to oral medications. So but follow your doctor's prescription. And next is the recent development with vaccines available for under 5 for children, and even coming up for adults. Now vaccines are available to be taken, and this is a way to prevent even getting the malaria disease. Thank you for watching this video. If you are yet to subscribe, remember to click on the subscription button so that the algorithm can project this video, this information to many more people, and by doing this you'll be helping this channel to grow. Remember to click on the like button if you like what you have watched. Remember to share with others so that more people can fight, and we will all be winning the war against malaria. Thank you once again for watching. See you in my next video. Remember, zero malaria begins with you. Bye for now.